Hello, a new Health Foundation report has highlighted a decline in the healthy life expectancy of women in Britain. We've fallen as a country from 14th to 20th in a league table of the 21 most wealthy countries in the world. Only the US does worse now. And as if that wasn't bad enough, the story for poorer women is even more dreadful. If you're born in Hartlepool as a girl, you can expect 51 years of healthy life. If you're born in Richmond-on-Thames, then the figure is 70 years. A 20-year difference. In fact, poor women can look forward to 30 years of unhealthy life, whereas more prosperous women can look forward to only 10 years or so. And the reasons for that are that there's actually a medical misogyny at work here. There's three main aspects to this. First of all, women, and particularly poorer women, do an awful lot of unpaid caring for others. And that has a dramatic effect on their own health, both physical health and mental health. Secondly, poorer women are much more likely to be employed in the healthcare industry, and particularly in social care for people who are old or are disabled, or for children, and that is punishing work, both physically and mentally. And the third aspect that affects women's health is that women's ill health is more likely than men's to be dismissed as anxiety or something we don't really have an answer for, so you'll just have to grin and bear it. As Trump recently said concerning paracetamol causes autism if the mother takes it while she's pregnant. Trump told women in America that they need to think of the health of their unborn child and grin and bear it if you can. Take one for the team instead of looking after their own health. So that sort of attitude pervades medical science, pervades the way that we provide health for women. If you've got endometriosis, then you might take 10 years to wait for a diagnosis. The waiting lists for gynecological problems are longer than almost any other waiting lists. Well, it's all right, because Wes Streeting, our British Health Secretary, says he's prioritising women's health in the new British health policy. Well, that claim really isn't borne out by the numbers. And new health budgets have ring-fenced £5 million extra for women's health, whereas for men's health the figure is £8 million extra. And when you think of that, £5 million is spread not only in terms of delivering health services, but also in preventive education in schools, education about menstruation, education about looking after your health as women, then you can see it's not going to stretch very far. So Streeting isn't even putting his money where his mouth is. And what we need is a radical review, reassessment of how we should prioritise women's health to redress a medical misogyny which goes back to really forever, because most doctors have traditionally been men, most decision makers have traditionally been men, most policy makers, most politicians, traditionally men, the people with control of the purse strings, traditionally men, and that means that however much we know women's health and women's needs are very prominent, we don't actually match that up with the decisions we take, because being men, obviously we're more alert to the needs of men, and when there's a competition for scarce resources, then who wins out? Well, who's making the decisions? There we are. We're all aware of it if we work in the health sector, and we just need to do something better about it. Raise our game, Mr. Streeting, and shut your mouth, Mr. Trump. Bye.